Hi, this is Larry Bauer, Chief Executive Officer of the Family Medicine Education Consortium, and I'm pleased today to be talking with a couple of people who have, I think, created a brilliant innovation, and I'll introduce them, and then they can tell us about the work that they've been doing. So with me today is Dr. Jeff Martin, a family physician at Penn Medicine Lancaster General Health, and Ms. Katie Schultz, who is a managing attorney with Mid-Penn Legal Services in Lancaster, Pennsylvania. Thank you very much for joining with me.
Thanks for having us.
So I'm fascinated about this idea of a medicine legal partnership, and I'm wondering if you can tell our listeners some background about this, when it began, how it began, and then we'll get into the nuts and bolts and how it works.
I wonder if it would be helpful just to start with a very quick summary of what legal services is and what we do, because I think that's important for context.
Okay, good.
So I work for Mid-Penn Legal Services, which is it's called a civil legal services agency. We are part of a network of nonprofit organizations across the country, which provide free legal services in civil matters to people who are very low income. So we're not the public defender's office. That's the folks who provide representation to defendants in criminal cases. We try to be sort of a legal crisis safety net for folks who are facing crisis level civil legal problems such as eviction, loss of income, custody, need for a protective order in a domestic violence case, loss of a job. There's a bankruptcy, consumer law. So there's a wide variety of things, but that's what Mid-Penn is one of those agencies. And so we're out there in the community. Typically, our offices are near the courthouse in whatever town in which we're based, and we do our best to meet needs. At current funding levels, legal services offices are able to meet roughly half of the demand out there. So the funding is always a struggle, and I think that's just important context in terms of how we arrived at the model we have here. I just wanted to put that out there initially. Yeah.
Very helpful. And so how did you get connected with family medicine?
Well, we actually connected when I was as the president of the City Board of Health, and I really didn't know much about civil legal aid, but we were dealing with a lot of actual houses that had lead problems. And these houses were being rented over and over again to different families, and it seemed like the problem was never being abated. And the other physician on the Board of Health and myself got so frustrated we were going to publish the addresses of these houses in the newspaper. And then he said, "Oh, wait a minute, I know somebody who's an attorney," and that's where I met Katie. Katie wrote a letter to the mayor, and almost like within 2 to 3 weeks, things started changing dramatically, and we ended up having a new lead ordinance. And so it was the first time in my medical career that I really saw the benefit and power of legal intervention, which was just something that wasn't really on my radar screen. Shortly after that incident, Katie and I met with each other when I was starting our clinic for high utilizers, our so-called super utilizer pilot. And when I was coming up with the multidisciplinary team that would provide care, of course, I thought of providers, and I thought of social workers and care managers and a pharmacist, but immediately thought of Katie as being a member of our team. And I believe it was the first time that a lawyer was embedded into a care team that was dealing with folks with complex health and social needs like we were. And we immediately saw amazing results.
So when you say that someone's embedded with your team, what exactly does that mean?
Well, what I envisioned from the very beginning was that Katie wouldn't just provide services, meaning that if we identified a legal need on the healthcare side, then we would just tell that person, well, go down to the street to the Mid-Penn Legal Services offices, meet with Katie, and she can take care of you there. I envision Katie actually being a fully functioning member of the healthcare team. So she would meet with us in the morning. She would be at our clinical huddles every morning when we talked about difficult cases. She would have complete access to all the other team members, just like all of us do. She would be able to go out to people's homes. It was really, I think, and the main innovation was really taking the legal service consultation to the patient. And it was interesting because we realized, and when we surveyed patients, that a large percentage of them had legal needs but had never sought legal representation. Well, we know now that if you have the ability to get in a car, drive down the street, look up where the Mid-Penn Legal Service office is, drive down there, and meet with a lawyer, you are by definition in a lower risk category than most of the patients that we take care of now in our high-risk clinic. So the innovation was really, how do we take this vital, important service, as vital as the pharmacist or the RN care manager, and make it work for patients where they live and where they exist. And so I think, to me, that was really the biggest innovation.
Right, because the same barriers that are preventing these complex patients from interacting, engaging successfully with the healthcare system are also preventing them from engaging successfully with the full range of social services. So that's exactly it. I think what's really unprecedented in our project is the level of integration that's been achieved. So my being present at the meetings, really having a kind of fluid back and forth with the other healthcare team members. I use the same, I communicate with them, I have read-only access to the electronic health record, and I use the secure messaging function that the rest of the team uses to communicate. And I think that's huge. They don't have to remember to call or email or somehow reach out to me in some different way. I'm part of the communication loop. And there's three functions a medical legal partnership attorney serves. One is to provide services directly to the patients. So someone's being evicted, I go to court with them and represent them. If they're fighting for their Social Security benefits, I'm at the hearing with them. But there's also an educational component. So I'm periodically provide trainings for the healthcare staff about in ways that I think enhance everyone's ability to work to the top of their license. So in terms of how to handle certain types of applications or just how to spot legal issues, that can be a real, it can be hard sometimes to peel back the layers of onion and say, oh, this is actually a legal need. So that's part of the training. And then there's also the systemic advocacy. That's an example of which is that the lead paint thing Jeff mentioned before is getting involved with the City Board of Health and helping to advocate for certain changes to the lead paint ordinance. So an intervention that has a much broader impact.
So in addition to that example, can either of you think of some other examples you might mention that would help listeners know the power of the collaboration?
Yeah, I mean, we both have tons of examples. One of the examples that occurred very early on, which stuck with me to this day when we actually formed our high-risk clinic called Care Connections before we had a 2-year pilot. It was during the pilot where we met a gentleman who was in the hospital frequently, mainly because of lower leg infections. He had chronic edema, he had skin grafts that were botched, and he was unfortunately about 500, 600 pounds, and he was being admitted pretty much on a weekly basis for these infections. He was quite depressed. In fact, a wound care doctor talked to him and said, I'm not sure there's much more I can do for your legs. He wasn't able to actually walk at that point. And he kind of gave up hope. On top of that, he was finding that his Social Security disability benefits were being cut in half. And he was very confused by this. Well, so our lawyer got involved, and within a few weeks, quickly discovered that his Social Security check was being improperly garnished, and there actually may have been some identity miss up so that they were going after the wrong person. Well, for whatever the outcome of that case was, that he ended up having full security, his Social Security benefits restored. He ended up, since somebody had reached out to him and helped him to that level, he became less depressed. He started taking a more active role in his health, and he'll tell the story. There's actually a YouTube video out there about it. And he ended up having bariatric surgery, lost a lot of weight, and hadn't been hospitalized then for about 4 or 5 years after that. So it was kind of a matter of, meeting a person's need that we wouldn't necessarily have thought of as a, quote, healthcare need, but also in a way where it rehumanized him and made him feel better about himself. So that's a story that has consistently stuck with me. I'm sure Katie can tell you one too.
Yeah, I'll just another one. I mean, so that highlights, Jeff's example highlights sort of maintaining or creating access to income streams, which can be really key in terms of stabilizing someone's life situation and therefore their health. I mean, another big role for where an attorney can be helpful is in preserving housing. So I'm thinking of a patient who was had some pretty severe mental health needs, struggled with addiction, and unfortunately was not really open to getting treatment for those things. And so there were some undiagnosed, what we suspect are undiagnosed problems, but did not get along with her landlord, and was really being evicted because of her behavior. And it was just as, if someone is just completely out of money and can't pay their rent, and they're being evicted for non-payment of rent, I mean, there's not a whole lot I can do in that situation. There's no magic solution to being plain out of money. This was really different, though. There were some real matters of a factual dispute. There were defenses to be raised. I did not think that the landlord had properly sort of worked with her to accommodate her behavioral health needs. And so I fought the eviction, and I ended up appealing to the next higher level of court, and ended up keeping her housed for, I think, an additional 8 months, until she was able to find another affordable living situation. This was someone, because of her physical health needs, she had an LVAD, really was not appropriate for your typical group homeless shelter.
A left ventricular assist device.
So I think it was really life-saving for her to be able to keep her housed, and that was something that really required some extensive intervention that only a lawyer was capable of doing. And just to give another quick example on a very different level, there's also the much sort of more efficient interventions, just where being such an integral part of the team can let me help solve problems with really minimal expenditure of resources. I can think of a time that one of the patient care navigators had just enrolled a new patient who had just lost their food stamp benefits, and she was puzzled over why this patient would have, immediately or be losing benefits. And I was aware that there had recently been a change in the law in Pennsylvania where certain folks are under a limit in terms of their lifetime amount of food stamps unless a certain form is filled out certifying disability. So that's something that, just by virtue of sitting there in the room with her at the next desk, I said, oh yeah, I think this is the situation. This is the form you need. She printed it out, spoke to the provider about it, and the patient had food stamps reinstated within a week, versus applying again, not having the right form, being denied, calling the legal services office for an appeal, and months go by before this person actually has some funds on hand to buy food. So that took 5 minutes of my time, and made a big difference for a patient.
Those are some very powerful stories. So I'm curious, Katie, what was it like for you as an attorney to come into, especially when you're working with a team that's looking at super utilizers, those are really complex people and challenging circumstances. What's it like for you as an attorney to become a member of the team?
I mean, it's really unique. It definitely takes me out of my comfort zone because I've got, I'm operating with a very different sort of knowledge and skill set. But I really think that in the end, it's my ability to provide legal services to my clients is enhanced by being part of the medical team, because these patients being so complex, if they were able to present to the legal services office to apply for services, we would be overwhelmed because the web of needs is so dense and complex, and we're not necessarily equipped to, we're lawyers, we work out of an office near a courthouse, we're sort of trained to specifically deal with the legal need. But what if our client doesn't have enough food and isn't able to get to the doctor or to the pharmacy to get medications because of a lack of transportation? It all feeds into, one need feeds into another, and so working with the medical team really lets me to focus on the legal needs and the things where my skills are meant to be used. Whereas then if there are needs that could be better met by the pharmacist, by the patient care navigator, by the provider, it's great to be able to put our heads together and figure out who's best suited to do what for the patient. And particularly, Social Security disability is the best example where it's sort of obvious why being part of the medical team is really helpful, because it helps me to understand what's going on medically and how to convey and express that to the judge who's hearing the case. But in housing cases, for the example I gave before, the eviction that I defended, having information and from the healthcare team to help me better understand her medical needs really helped me to be a better advocate for her from a legal perspective. So I think we're also, so in terms of it really in the end, I think helps us, all of us, to do our jobs better. You're from the sort of confidentiality and information sharing perspective, we're always sort of pushing the envelope. I think that all the systems at which we've arrived are the hospital's risk management team is comfortable with where we are, but that always is potentially throwing up an additional set of challenges to figure out how this diverse team of professionals can work together within all the rules, the ethical and confidentiality rules of which we all have to be aware.
Well, I have to tell that I'm even more impressed hearing the stories and hearing the it's beyond collegiality. It's how the functions fit together, particularly for people with complex problems. This just makes so much sense. And I want to congratulate both of you on figuring out how to make this work.
Thank you.
Thank you. Now, the main part of it that we have to really figure out is how do we get the insurance companies to fund this kind of care, because at its essence, what we're doing is really high-level, intensive care management and dealing with problems that impact on the healthcare side. So that's the next step.
Well, if there's any way I can help with that, I will be happy to do that, because it makes a great deal of sense, especially when you're dealing with high utilizers. The money that's saved by the insurance company, that gentleman who was being admitted every week or every other week, that costs a lot of money. And
right.
One intervention like that can reduce that cost so that the savings can be invested into the kind of work that you're doing here. That just makes a great deal of sense. And maybe as this podcast interview gets shared around, perhaps, and I will be sharing this with people that I know who are health system leaders, who are leaders in the insurance industry, maybe this will help this idea to catch on. And I did want to ask if I can have your permission to put your names associated with this and perhaps an email address if people want to contact you for more information. Would that be okay with the two of you?
Yes, that's fine.
That's fine with me.
Great. Well, I'd like to thank you very much for talking with me today, and I'm looking forward to you sharing this innovation at our Innovators Network meeting that'll be in Lancaster on November 1st. I think others will be very interested in hearing exactly how this works. So thank you very much.
Thank you, Larry.
Thank you.